Hello viewers, as we have already discussed about the overview of myocardial infarction or heart attack in the previous video. You will find the link above or as well as in the description. Today, let's discuss the management of acute myocardial infarction. The first goal for healthcare professionals in the management of acute myocardial infarction is to diagnose the condition rapidly, then provide treatment for restoring the blood flow, that is perfusion, to the muscles of the heart, that is cardiac muscle, either by medical treatment or surgical procedures. Now let's discuss about the management of myocardial infarction. Management of myocardial infarction is divided into three stages, that is pre-hospital care, hospital management, then post-hospital care. Pre-hospital care include oxygen therapy, aspirin 325 mg, which should not be enteric coated and chewed before taking. Nitrates, which work as both painkiller or vasodilator, and transfer the patient to appropriate medical center. Now let's discuss hospital management. Hospital management include oxygen therapy, drug treatment, reperfusion therapy, and post-discharge rehabilitation and chronic medical management of coronary artery disease. Drug treatment include antiplatelet drugs, antianginal drugs, anticoagulate drugs, and other drugs like Digitalis. Reperfusion therapy include fibrinolytics or angiography with percutaneous coronary intervention or coronary artery bypass graft. Now let's discuss oxygen therapy. Arterial hypoxemia is frequent occurrence during first 24 hours after myocardial infarction and is more common after the use of opiate analgesia. So, oxygen is given typically 2 liters by nasal cannula. Now let's discuss analgesic and antiemetics. The pain of myocardial infarction is usually severe and requires both opioid analgesia and antiemetics. Intravenous diamorphine 2.5 to 5 mg should be given and it should be repeated as necessary. It is the drug of choice and it is not only a powerful analgesic but also a useful anxiolytic. Now let's discuss nitrates. Nitrates reduce myocardial workload and has myocardial oxygen demand by reducing preload with vasodilation and afterload by reducing peripheral resistance and blood pressure. Now let's discuss reperfusion therapy in myocardial infarction. For STEMI, reperfusion strategies include fibrinolytic therapy or immediate percutaneous coronary intervention. Emergency percutaneous coronary intervention is preferred when it can be performed within 90 minutes. However, when there is delay in percutaneous coronary intervention, then reperfusion can be done by giving fibrinolytics. Fibrinolytics should be given as soon as possible as it has greater benefit to the patient when given within 3 hours. But it may be effective up to 12 hours while it has no benefits after 24 hours. These fibrinolytic medications include tissue plasminogen activator, reteplase, streptokinase, and tenecteplase. For patients with NSTEMI, angiography may be done within 24 to 48 hours of admission if patient is clinically stable. However, if the patient is unstable, that is, patient has ongoing symptoms, hypotension or sustained arrhythmia, then angiography must be done immediately. Now let's discuss drug treatment of myocardial infarction. Patient with acute myocardial infarction should be given the following unless contraindicated. Number 1, aspirin. Aspirin has potent antiplatelet effects as a result of the inhibition of platelet cyclooxygenase. Daily dose of at least 75 mg can produce almost complete enzyme inhibition in less than 1 hour. Number 2, glycoprotein 2B upon 3A inhibitor when percutaneous coronary intervention is done. Antianginal therapy, it is usually nitroglycerin. Beta blocker. Beta blocker reduce myocardial oxygen demand as a result of reduction in blood pressure and heart rate. They also have antiarrhythmic properties. Early IV beta blockers should be avoided in patients who are hypotensive or in cardiogenic shock. Now let's discuss ACE inhibitor. ACE inhibitor should be started within 24 hours if there is no evidence of worsening kidney failure, high potassium, low blood pressure, or narrowing of renal arteries. Now let's discuss statins. Various medication can lower blood cholesterol levels. They may be prescribed individually or in combination with other drugs. They work in body in different ways. Some affect liver, some work in the intestine, and some interrupt the formation of cholesterol from circulation in the blood. Now let's discuss digitalis. Digitalis increases the force of heart contraction. It is given in the patient with heart failure and for irregular heartbeats, that is atrial fibrillation. Now let's discuss magnesium. Intravenous infusion of magnesium reduces peripheral vascular resistance while increasing cardiac output with no increasing in the cardiac workload. Magnesium may also increase the threshold for depolarization of cardiac myocytes, thus reduces ventricular arrhythmias due to injury currents in ischemic tissues. Insulin. Diabetic patients have significantly worse prognosis after myocardial infarction than those without diabetes, mainly because of left ventricular dysfunction and increased reinfarction rate. Therefore, insulin should be given to control blood sugar levels. Now let's discuss lifestyle modification. It is very important to modify the lifestyle before or after myocardial infarction, and we should control blood pressure, blood sugar levels. We should do exercise regularly, discontinue smoking, take alcohol within recommended limits, maintain healthy body weight, and remain compliant with the medication. Exercise. Physical activity reduces risk of cardiovascular disease, and people are at risk should do 150 minutes of moderate or 75 minutes of vigorous intensity aerobic exercise in a week. Diet. People with MI should eat more fish, fruits, and vegetables, bread, pasta, potatoes, olive oil, and margarine. Thank you for watching. Please subscribe the channel and press the bell icon so you won't miss any upcoming video. If you learned what you were looking for, then hit the like button, which motivates me to bring more informative videos.